Can you explain to the jury what is naturally occurring mesothelioma, and is it something that is recognized in the scientific and medical literature?
It is something that is absolutely recognized in the scientific literature. There is always a background rate of tumors, including mesotheliomas, which occur in a population which are unrelated to external environmental factors, such as, if we're talking about mesothelioma, unrelated to commercial amphibole asbestos exposure, unrelated to radiation. But you have to go through a systematic approach. So spontaneous tumors are absolutely, or naturally occurring tumors are absolutely recognized in the scientific literature.
And are they more prevalent in women?
Yes, indeed they are. The reason for that is because the higher proportion of mesotheliomas which occur in men are because of occupational exposures. Men have had exposures to commercial forms of amphibole asbestos at far higher levels than women. So they work in construction, in shipbuilding. This is typically the profile of persons. Men have far more mesotheliomas than women. They tend to occur because of occupational exposures. If you place a female cohort in an occupational setting and you expose them to commercial amphibole asbestos, will they develop mesothelioma? Absolutely they will, at exactly the same rate. There is nothing different. But what is different is that essentially, when you take the entirety of all the literature, men have been exposed to far more commercial amphibole asbestos, building products, construction, shipbuilding, insulation, cement. Those are the types of work that men have done, and that's why they have a higher proportion of asbestos-related mesothelioma. So as a proportion, in women, naturally occurring is a far higher significant level than in men.
And if someone were to come in here, Dr. Attanoos, and testify to the jury that either there is no such thing as naturally occurring mesothelioma, or it's simply cases where the cause hasn't been identified, is that something with which you agree?
No, I would respectfully disagree with that opinion. And there is a good foundation that the literature at present reflects that there is a very clear, significant, and sometimes very substantial fraction of mesotheliomas, particularly in women, which are not related to asbestos and are attributable, as we determine, to naturally occurring cancers.
Are there groups of individuals or test subjects, including animals, that have actually been studied to see whether or not mesothelioma, like other cancers, can occur naturally?
Yes, indeed.
And can you explain that at a high level?
Absolutely. And if I may show. If we look at the trends of mesothelioma in men, in the pleura, and this is data generated from the National Cancer Institute, surveillance, epidemiology, and end results, what we identify is from around 1975, the rates of mesothelioma in men have increased, reaching a peak in the mid-1990s in the United States, and thereafter the age-adjusted incidence decreases. That's an unusual profile. Men, pleural mesothelioma, increases, then decreases. If you look at asbestos consumption, and remember the association between occupational asbestos exposure in men, if you look at asbestos consumption,
Grounds.
Foundation qualification, Kinnemer.
These are all disclosed opinions, Your Honor. You may continue, yes.
Thank you. If you look at, to explain that, why does it go up and then come down? If you look at asbestos, what you find with asbestos is that 1945, the Second World War, just before from the United States Geological Survey, asbestos consumption did this. After the Second World War, rapidly went up, reached a peak in 1971, and thereafter dropped. 30 to 40 years later, what do you see? The same mirroring.
And is that
that's
consistent with the latency period between exposure and the development of mesothelioma from asbestos?
Precisely. 30 to 40 years between the peaks. Latency is a topic that we have not touched upon, but it is essentially the time from first exposure to the development of mesothelioma. It's the time it takes. And so it's 30 to 40 years. But what is remarkable in the United States in women, the rates of mesothelioma are much lower, and they are more or less stable over time, which is indicative that a significant proportion in the United States of mesotheliomas arising in women are not impacted by the asbestos. That does impact upon the plural rates of mesothelioma in men. That's one factor which underpins the key point that's raised. There is a lack of time trend between asbestos use and female mesothelioma rates in the United States from 1973 onwards. More or less stable. It's not exerting its effect.